Hey everyone, it's Dr. Kevin Wafer with Core Chiropractic in the Energy Corridor, and it's time for another episode of Ask the Doc. And today's question is, can chiropractors help with headaches? And the answer is yes, absolutely. And headaches are one of my absolute favorite conditions to treat. And a lot of times I have patients come into the office and they don't come in for headaches. They're coming in for neck pain, or they're coming in for lower back pain or sciatica, things people typically think of when it comes to chiropractic. And as I start to ask them questions about if they have any other health problems, even if they don't think they're related to chiropractic, and they often say, yeah, I tend to get headaches. And a lot of times it's not just they get an occasional headache. They've had headaches 3 times a week for the last 10 years. They don't even think about it, because a headache, they just take aspirin, they take Advil, it goes away, maybe it doesn't go away, but they don't relate it to chiropractic. And one of the most common reasons, or one of the most common types of headaches is what's called a cervicogenic headache, which is basically a headache that originates from the neck area. Now, when the first 2 bones in the neck, those are going to be the most common ones I check when it comes to patients complaining of headaches. When the first 2 bones in the neck, those are called atlas and axis. If they start to shift out of position, C1 and C2, they start to put pressure on the back of on the nerves that start at the base of the skull. Those wrap around, come to the head, and can lead to headaches. So anytime somebody tells me they've got a headache and it feels like it's right in the back of the head and starts to wrap around, I'm almost 100% sure that's one of those headaches, one of the headaches that I can absolutely help with chiropractic. Another thing I commonly hear when I ask people to get headaches is they say, yeah, I've had migraines since I was a kid. And I think a lot of times people fall under the misconception that a migraine headache is just a bad headache, when simply there's a very distinct definition of a migraine versus a different type of headache. Very few people actually get true migraine headaches. A true migraine headache is someone who has nausea, vomiting associated with the headache. They get this feeling of dread. They can feel the headache coming on. They might see visual disturbances like flashing lights. They can't be around any sight or sound. So migraines are a very specific type of headache, but I often find that patients that if they have a bad headache, they just call it a migraine, when in effect it's really just one of these cervicogenic headaches that we can actually help with. So I'm always surprised to find patients that just live with headaches nonstop and don't even think about it. Or the people that I've been treating for years, and they come to me and they say, hey, you know what, doc, I haven't had a headache since I've been getting adjusted. Is there something related? And the answer is yes, absolutely. Chiropractic can help with headaches. It's one of my favorite things to treat. So if you're sitting out there watching this video and you're wondering, man, I didn't know chiropractic could help with headaches, I'm wondering if they can help with anything else. Well, in this case, feel free to leave us a comment down at the bottom if you're wondering if chiropractic can help with any other health conditions, and I'll be sure to address those in future Ask the Doc videos. So hope everybody has a great rest of the day, and I will see you all next week. Bye.